Hello, and thank you so much for joining us today for the webinar Essentia, the smart simplification of a composite system. It is a great pleasure to introduce to you Dr. Javier Tapia. Dr. Tapia finished dental school at the European University of Madrid in 2003, working then as an associate professor in the prosthetic department. In 2005, he started his career as professional computer graphics artist. He founded the company JUICE, dental media design for this purpose. He received the Collegiate Merit Award by the Spanish College of Dentists from the first region in 2005 for his collaboration in the Commission of New Technologies. In 2011, he was one of the founding members of the Bioemulation Group. He actively collaborates with several universities across Europe and is member of GC Restorative Advisory Board. Javier works in his private practice in Madrid, focused on restorative dentistry and aesthetics. He is an international lecturer with participation in several articles in restorative dentistry, dental photography, and computers in dentistry. I would like to thank Dr. Tapia for being with us today and DT Study Club for making this lecture possible. Please take note of any questions and comments you have during the lecture, as they will be addressed by Dr. Tapia at the end of the presentation. Without any further delay, please help me welcome the expert himself, Dr. Javier Tapia.
Good afternoon, Europe. Good morning, America. And good evening, Asia. Welcome to this webinar about Essentia, the smart simplification of a composite system. This webinar is going to run through different sections. We will start with a part about color, and then we will move about all the way to do the shade selection properly in the current materials. And we will present Essentia and a new way, a different way, to layer composites. So let's get started with color. When we talk about color, we are talking about light. So light that we can see in the visible spectrum from 319 nanometers to 750, depending on the person. You will see that you have this short wavelengths on the cold colors and the long wavelengths on the warm colors. We have the spectral sensitivity of the eye, which is defined to be receptive to this different wavelengths. As you can see, the cones are responsible to see the color. You have also the rods that mainly are responsible for us to be capable of seeing in dark light conditions when we don't have too much light. And as you can see, they are just sensitive to more or less 500 nanometers and wide in the curve. So they are not really responsible of seeing colors, just to have capturing light. But what is our main interest is the cones, and as you can see, the human eye is more sensitive to green than any other color. So how this is working is, at first, in the eye level, is working as a trichromatic process. So we have the three basic colors, red, green, blue, for each of the cones, and they are mixing and they are generating the other secondary colors and so on. However, this is not working like this in the brain. The brain is processing the information in a different way, and this way is called the opponent process. So actually, the human vision is composed of these two different parts. We have first part of the L, M, and S cones, the RGB, same as any light emitting system. And then we have the other process in the brain, which is the opponent process, the LAB. As you can see, depending on the positive or negative input of each of the receptors, we will have a different value. It's called the opponent process because, as you can see on the A and B gradients, we have colors that really cannot be mixed in our brain. We cannot mix red and green. We cannot mix blue and yellow. You cannot see a different color that it's a result of mixing these two in your brain. It's not possible to mix them. So this is why it's called the opponent process. And of course, LAB values maybe it's something familiar for you if you have written some papers about color in dentistry. All the spectrophotometers, all the scientific articles, they use LAB values to measure color. However, this is not a very rational system for us for understanding color. So we still rely in the old system, the old Munsell color system, designed by Professor Albert Munsell. And this system is based on three different parameters, which is hue, chroma, and value. With these three parameters, we can actually define any color. There is no need to add more parameters to define a color. We will add more, but just to rationalize a little bit the translucency, opalescence, but at the end, all of these other parameters are just a change in one of these three original parameters. From the scientific point of view, we can define any color with this. So let's look at each of these characteristics on its own. Hue is what we understand about the color. It's just red, green, blue. It's very simple, straightforward. Then we will have chroma. Chroma is the level of intensity of this hue. It's just like a saturation. We can have a very pale blue, as you can see on the left, or we can see a very saturated, very intense blue, as we can see on the right. And finally, we have value. Value is probably the most complicated to understand. It's always the one that is generating more problems. And it's also because it's not really visible on many shade guides. So value can be defined as the amount of light that the tooth is going to reflect. If the tooth is going to reflect a lot of light, it's going to be very bright, very whitish. If it's not going to reflect a lot of light because probably it's very transparent, then it's going to be darker. It's going to tend to a black color. So this gradient from dark to bright is what value is. So of course, when we change, mainly in the tooth, when we change translucency, we will have a change in value. So all these three parameters together, they give us the color. So how this is translated into the usual things that we use, the usual guides? Well, you can see here the VitaShade guide and its arrangement is actually, you can see that we have different hues. We have 4 types, A, B, C, and D. Usually in nature, A is the most common. Then we have chroma. It's just a gradient. We turn from A1, A2, A3, increasing chroma until A4. But then we don't have any reference of value. And actually value is the most important parameter of these three. I will demonstrate this with this simple image. In this image of color pencils, we can see clearly all the different colors, red, green, blue. It's very visible. But what will happen if we take out the hue and the chroma from this image is that immediately we cannot make a difference between some of the colors that we already had defined perfectly, and now you can see that they have a very similar value. So when we have in natural teeth, this is one of the issues that we have, because there are really very different variations in value, but if we look just at chroma difference, it's a very slight difference. We have very slight hue differences. Between A and B shades, which are the most common, there is not a huge difference. But also between the A1 and A2, this is just a slight increase in chroma. And if you look at a patient in natural teeth, you will probably see that normally the patient have a A2 in the centrals, can have an A1 in the laterals, and then can have an A3 or even an A3.5 in the canines. This is very common. And is this really a problem? Is this really looking bad? No, it's not. It's looking natural. It's normal. And there is a huge difference in hue, and not in hue, but in chroma. And the problem is, if one of those teeth is modified, for example, we have a crown, metal ceramic crown, that have a opaquer underneath. it immediately will look with a much higher opacity, and that will be much higher in value. And that's very difficult to mask. Normally it will be very visible. And that's one of the biggest problems we always have. If you have one tooth that it's not really matching in value, then we cannot hide it. We cannot hide a restoration when the value is not properly done. If we have the proper value in our restorations, we have 98% of the restoration done. The last 2% will be just adjusting slight difference in hue and chroma, but that's not a problem, especially with composite because it's very mimetic generally. So let's talk a little bit about light interaction, because yes, indeed, we have just 3 parameters to define any color, hue, chroma, and value. But let's see how light interacts with the natural tissues and how these parameters are going to be generated, because there are different things that will happen to the light, and we need to control all these different parts. We have the specular reflection, we have the absorption, emission, and diffuse reflection. So let's start with specular reflection. Specular reflection is what we see on the surface of the tooth. The light is going to be reflected on the surface, so we don't have any modification of the light. The light is still the same. As you can see here in this picture, you will see the reflection of a flash in the surface of the tooth. And this light has not been modified. It has the same color as when it was emitted from the flash. But of course, a difference in the surface will produce a difference in the kind of reflection that we will see. When we have a very flat surface like this, we will have a very sharp reflection. The light is going to be reflected with the same angle of incidence, and it's going to produce like a mirror effect, a glossy appearance. However, when we have a blur reflection, when we have a texture, a surface texture like this, each of these bumps is going to be like a small facet that is going to reflect the light in a different direction. So actually we will turn into a blurred reflection, a matte appearance. It's not really that the tooth or the surface is not reflective, it is reflective. But because of this surface, the appearance is going to change completely. Here we have a comparison between different spheres, metal spheres. On the right you will see a very perfectly polished metal sphere that can reflect completely the lights surrounding. Then we have a sphere that has been sandblasted, very soft sandblasting, so we can still see reflections, but they are now really blurred. And then we have a heavy texture on the last one, on the left, and that will immediately start getting rid of all the texture, all the reflections. The reflections are still there, but they are very subtle. And overall, it looks much brighter, like a gray sphere instead of a black polished sphere. If we look at the more dental example like this is a tooth sample made with composite, and it's the same, exactly the same shade, exactly the same tooth. The only difference is the left one is polished, and the right one is unpolished. And you will see how different they look in color. Immediately the right one looks much brighter, like with much more value, and that's only because of the specular reflection, because there is a micro surface, micro texture in the surface that will produce these blur reflections. While on the other one we have a flat, more smooth surface that can let light pass through easier, so we can see this more transparent material underneath. So you can see that in patients, of course, we have a young patient here, but with a little bit of acid erosion, and you can see how flat the surface of these teeth are, and you see the very sharp reflections, and it's a very smooth surface. It's like a mirror. And then we have another patient, also very young, but you can see now that this micro texture in the surface will immediately show this blur, this big reflections on the surface that will increase immediately value. And that's one of the reasons why on very young patients we have usually this situation. We will have in kids, we have this chalky surface, chalky shade, very whitish. And it's, of course, it's because other things like the natural color and also the mineralization level of the enamel, but also you have the specular reflection component. So let's move into the next parameter, the absorption. Absorption is very simple, very straightforward. When we have a black object, the black object is actually black because it's going to absorb all the light that is hitting this object. While when we have a white object, it's actually the opposite. All the light that is going to hit the object is going to be reflected back. In the case of teeth, we tend to have a very reflective surfaces. There is not very much absorption, and normally all the absorption that we have is on the dentin, and also it's not really a lot because we are talking about not opaque materials but translucent materials. So actually when they tend to go to like a blacker color, darker color, it means normally that they are more transparent, but not really that they absorb more light. Let's move into emission. Emission is going to happen in the form of fluorescence. Fluorescence is the property of some materials to receive a light that it's not visible to the human eye. It's lower wavelength than the visible spectrum. It's going to absorb this light and immediately is going to release this light, to emit this light back, but now in a visible spectrum, in a visible light. This is happening especially in dentin, as you can see from this beautiful picture, this cross-section, thanks to Dr. Bassos. You can see that we have 3 times more fluorescence in dentin than enamel. So this is basically the behavior we have in natural teeth, and we of course need to have fluorescent materials in order to match the natural fluorescence of teeth. But there is also another kind of fluorescence, it's a green fluorescence, that it's happening actually not with invisible light, but with visible blue light. There is a small amount of the blue light that is going to be absorbed and then emitted into green light. And this is what is being used now, very popular in these days, with the phase technology, the fluorescence-aided Carex excavation devices. It's just a lamp that you can use, and with this lamp you put your filter on, like you see these glasses. It looks like a light curing unit, but it's not. However, the LED that is emitting light in this case is very similar to the ones that we have in a light curing unit, especially wide spectrum LED. Actually, you can even use some lamps that are wide spectrum to do this. And you can see that when we use this lamp, you will see that the natural tooth is fluorescing green and decay is going to fluoresce in red. So it's really useful as a caries detector. When we are working, we are cleaning our cavity, we can check if it's clean already with this device. It's much cleaner and easier than using the normal liquids. So if you want to try, this is definitely one of the easiest things that you can try for checking also the integrity of margins, and if there is any leakage in all restorations, it's also useful for that. And finally, we move into the diffuse reflection part. Diffuse reflection is actually the most important part, because the other ones, we talk about specular reflection, also emission, they are just like modifiers. Just modifiers of the light, of the color. The main color is going to come from the diffuse reflection. So this is the 3 different kinds of interactions that light can have once it has crossed already the surface. We can have, as you can see here, this is just a schematical example, can be a composite, can be enamel, can be dentin. The thing is that we have like a composite material with a matrix and the particles, and you see that the light has already crossed the surface and get inside the material. So first thing that can happen is that it eventually hits one particle and gets reflected immediately. The other option will be that it's going to be refracted. There are 2 types of refractions that we can have. We can have the single refraction, as you can see in the center. And in this kind of refraction, the light is going to be just refracted once, and it's going to be transmitted through the whole material. This is more or less the behavior that we will see on the very transparent materials. And then we have the multiple refractions, the scattering of the light, which actually the light is going to be started to play, to jump inside the material. It's going to jump from one particle to the other through the matrix, and this is normally because of the size of the particle together with the difference between indexes of refraction inside the material is going to have this behavior, which is actually a very natural behavior, especially in the dentin. The dentin is behaving like this, is scattering light. So light is going to go outside, but it's not going just to cross the material, but the light is going to exit the material from another point, which more or less could be aleatory, not really fixed angle. So as you can see from these three different types of interaction, the left one, the reflection, will define an opaque material, very opaque material, because it's going to reflect immediately the light. This is the typical behavior of an opaquer paste that you will see on top of a metal ceramic, of the metal cupping on a metal ceramic crown. Then we have just one transmission, one refraction. So we have transmission that will be the transparent material, like enamel, or even more transparent than that. We have some shades that can do this kind of effect, very, very transparent. And then we have the translucent materials, which is more or less almost all the composite materials we have in the market. They are all translucent, with the exception of some special enamel shades that are very transparent. Normally they will behave like on the right, the scattering. So this defines a translucent material. Of course, you can have a mix between them. So you will have translucent materials that are more transparent, or other materials that are a little bit more opaque. But still, the main behavior is translucency. So all these parameters at the end will define these two characteristics, the opacity to transparency gradient, the translucency itself, and then the opalescence. Opalescence is a very simple thing, is not very visible in many shades. It's actually, there are very limited shades in the market that can show a very natural opalescence. And opalescence is a selective, actually just a selective scattering of the light. That means that only part of the spectre is going to be scattered and the rest of the light is going to be transmitted. As you can see in this illustration, the same as before, we can see that only the blue light is going to be scattered while the rest of the spectrum is going to cross the surface. So this is the behavior normally of natural enamel. We will have the opalescent effect. It's called the Rayleigh scattering. So when we put a frontal light like this, we will have the blue light being reflected back, and the long wavelengths, the red colors, the orange colors, is going to be transmitted. So we can see, like in this illustration, like in this picture, we can see perfectly the areas that are not supported by dentin. We will see very well this bluish color in the halo, in the incisal edge, very clear. However, when we put the light on the back, the opposite effect is visible. All the blue light is going to be scattered back to the palatal, so we will not see it. And the only light that will cross this volume of enamel and it's going to go out on the other side is the red color, orange color. So we will see this beautiful orange halo in the incisal edge. So this is natural opalescence. And of course, mimicking this with a material is not so simple, because there are some materials that are maybe too opalescent, others are very little opalescent. So eventually there are a lot of times that we can see some artificial opalescent shades like blue opal, orange opal. If you have this kind of shades, these shades are not really opalescent. They are not really naturally opalescent, because if one shade is naturally opalescent, it should be blue with transmitted light, with reflected light, and orange or red with transmitted light. It should be both at the same time, not really one of them, with which normally it's just a transparent shade with a stain, blue stain or orange stain. However, as in natural teeth, this effect is controlled by the orientation of the rods, of the enamel rods. It is actually very difficult to mimic. So normally we tend to be very careful with this kind of shades. When we talk about translucency, one of the most important things to take into account is that we can't really use too much light to see the translucency. When we look at this picture, it's a little bit overexposed. When we put too much light on the light of the chair, we will not be able to see the translucency properly. So it's better to put a contraster and then to lower the light, as you can see here, and then we will immediately start to see the translucency. On the translucency, the important thing is we need to check the difference between the tissues, because we have two tissues, we have dentin and enamel, and we have change in translucency in both. First, enamel, we can evaluate enamel. Of course, enamel can also change with the age, because we start, as we see on this illustration on the right, we start with a very thick enamel, very thick glass, that it's really rough, is really with a very rough surface texture, so you cannot really see very well underneath. And then we move into a thinner enamel that is more flat, and of course that will mean that it's a much more transparent enamel. Of course, when you see this kind of pictures, a very young patient, this is just recently erupted teeth, beautiful picture by Dr. Cerny. You cannot see the halo effect. You cannot see the translucency area here. Normally, let me just signal here. You cannot see the halo, just barely see the halo effect. This is not going to be visible until this area is going to be polished. When the patient starts biting, this area will start to polish and will start to thin out, and then we will start seeing translucency. So, when we want to check also the dentin translucency, it is a little bit more tricky, because we need to look at the mamelons, we need to look at the structures through the enamel. But if we learn how to look at it, we need to define and we need to understand that there are different kinds of dentin, different degrees of translucency in the dentin. So this is a very young patient, and you will see that the dentin is very uniform. From the cervical to the incisor, the mamelons are very opaque, we can see them very clearly. However, when we move into an older patient, we might still see some opaque dentin here, but the rest is very like a big block of more transparent material. So the dentin has become much more transparent. This is normal. The hypermineralization process that takes place in natural teeth is always doing this, is going to change the translucency. If you're more interested in this topic, I really recommend you to read this article from Dr. Bazos and Dr. Magnier in the European Journal of Aesthetic Dentistry, which is called Visual Synthesis. It's the second part of the Bioemulation Foundation articles. And it's really interesting to understand all this change in properties. But the important thing is that we have really two aging patterns here, which is the enamel aging, that will change from a young enamel, which is it's very high value, very high opacity and low chroma, to a mature enamel with very low opacity, very transparent material, and then with a higher chroma normally coming from stains. We can get rid of the stains, yes, we can reduce the chroma, we can revert the lower part, but we cannot make a change on the upper part. The opacity cannot be changed because this is a microstructural change, it's not stains. In the dentin, the same thing happens. We start with a young dentin that is very opaque in low chroma, and then we move into a dentin that is much more transparent and also more chromatic. Again, it's possible to remove chroma by bleaching, but it's not possible to reduce opacity, translucency. So this is pretty much the evolution that we can see in natural teeth. You see from a young patient to older patient, you will see different stages with different translucencies of dentin. You can have so many different examples, all these pictures taken with polarized filter, cross-polarization filter that helps removing all specular reflection, so we can really see all these details underneath. It's very interesting to see all the difference between the opaque dentin and translucent dentin. So the fact is that we need different materials, of course, to mimic these effects. Let's move into the shade selection, how we can really look at the teeth and on a classic approach, how we can make the shade selection. Normally we start with our shade guides. Maybe we can use the Vita, maybe we can use another one, we can order by value, whatever. This will be the classic approach. I will discuss a little bit if we really need this in the future. And we will look to the cervical third, which is the more stable dentin, and here we will see our base color normally, and this is where these guides can be a little bit more useful because we can see the base color here. But this is more or less the only thing that can help us from these guides. Then we will evaluate where the difference in translucency, where is the difference in translucency and the dentin. Here we can see that we have a part of opaque dentin, and then the mamelon, the incisal third, is with a more transparent dentin. Of course, we have same pictures as before, older, younger patients, so we need to adapt our layering technique in order to match these differences. Then we will look at the enamel, and we will evaluate the enamel translucency and the chroma. Usually the trick is just to divide the guides into some steps, and then as we go for more chromatic colors, we will just use a limited amount of shades, and we will start with a low translucency and low chroma, going to a higher translucency and higher chroma on older patients, older teeth, more chromatic teeth. There are different approaches depending on the brand. Some of the brands, they have a specific shade, enamel shade for each of the Vita colors. Well, in my opinion, this is something that we can start changing, and I will show you later. Enamel texture is the final step. We need to evaluate the specular reflection. If the surface is very rough or not, we need to mimic this surface with our restorations. We cannot really just polish and give a flat surface to a young patient because it will not work. The restoration will never integrate. However, this is something that we cannot check as before with the polarized. We need to use some diffusers of light, and we need to evaluate with something that can really give us an idea of this surface, of how much roughness we have on the surface. And now we have other options in order to make the shade selection. And for me, this is actually the best that you can do, which is just using small bits of composite. You can take a very small amount of composite and put it on top of the natural tooth, or the tooth in the side here, or on top of the tooth that you're going to treat. And this is going to give you the real input, because when we look at the shade guide, we are looking at a plastic tooth, and we're not really looking at the material that we are using. And we cannot expect just by using one A2 shade that the final restoration will be an A2, because the final restoration will take also color from the natural structure that is underneath. So if we want to cover this discoloration, the best option is to try different balls of composite on top. And we light cure, and then we will be able to see the mix between the natural structure, the underneath structure, and the composite that we are putting on top. And this is the best option. And for the enamels, we go to the incisal third, like we see in the lateral. In the central, we see them on the top of the surface. It's not really making any effect, but on the lateral, we can see very clearly the effect that we can achieve with these enamels. So this is the easiest and the fastest way in order to confirm the shade selection for our materials. Much better than using any other shade guide. And it's really quick. I really recommend you to use this technique. Are the standard shades guides a good reference? Do we need really them for dark restorations? Because at the end, if you look at 95 or even 98%, we always end up using just 3-4 shades as a main base. Maybe we are moving between B1, A2, A3, maybe some A3.5, but normally we don't use a full range. And also if you start looking at differences between different composites, different brands, you will see that the A2 from one brand is different from the A2 from another brand. And also the opacities are different. And the Vita sheet guide is a guide that is designed to do some metal ceramic work. It's not really designed for composite. So what is actually an A2? What is actually an A3? There is no real reference that we have of an A2 and A3. It's just our comfort zone. We just name this A2, A3, and we feel comfortable because we think we know more or less, because an A2 maybe more or less in different brands could be the same shade. But at the end, it's not really the same shade, it's a different shade. But it can more or less blend because it's composite. Do we need this for our restorations? If you look at the cross-section of these guides, they don't look like natural tooth. They have a very thin layer on top of the big block of dentin. It's an overbuild of dentin. This is not like a natural layering approach. I prefer to go for a more natural layering approach, trying to understand natural structure and modify my layering strategy in order not to try to copy a metal ceramic crown, but trying to copy nature, which will be, of course, our ultimate target. So how many composite shades do we really need? If we start looking at the brands, at the different shades, we will have brands that go full on Vita range, brands that simplify and just take the A range, taking out the other ranges. We have different opacities. Maybe some companies, they have only one opacity of dentin. Others, they have 2 or 3 different opacities. So we have opaque dentin, normal dentin. The body shades are normally a mix between dentin and enamel. It's in between them, just normally designed to do a one shade restoration. And of course, we have a very complex kit here, and we will start taking one syringe from one kit, another syringe from another kit, and we will end up with our kit, custom kit from different brands, different compositions for enamel, because we would like to have some properties on the enamel that we don't have on the dentin and so on. So it's very common that we end up with a big mix of materials. When we are working and we start to understand how to work with composites, it's very, very common that we mix materials. But is it really possible to simplify? Can we simplify this? And of course, yes, we can. And this is what we've been working in. And as you can see, Leonardo da Vinci already said that simplicity is the ultimate way of sophistication. And indeed, when you understand better how nature is, then you will be able to simplify. And I would like to present you this material from GC, which is the Essentia. We call the smart simplification of a composite system because it's really a simplified system, but it's not just taking out the number of syringes and so on. No, it's really designed to replace mimic nature as much as we can. It has been developed within the Restorative Advisory Board at GC. You can see all the members of the advisory board here. And this is the basic system. It's a shade system that will have 3 dentins and 2 enamels, together with a masking liner and a universal shade. The masking liner is a flowable paste to cover discolorations. The universal shade is mainly designed for posteriors in order to make a one-shade restoration. It's just like a body shade. The dentin and the enamel shades, well, it's on the enamel part, is very similar to what we can see also in the market on the shade colors. You have a whiter enamel, light enamel, and a dark enamel. One is high value, high opacity, and the other one is a little bit more transparent with more chroma for an older patients. And then we have, and this is the key difference, we have the light, medium, and dark dentin, only 3 dentins, and they change in chroma, of course, but the unique thing is that they also change in opacity. So it's actually adapted to the natural evolution. We have a light, very opaque dentin for young patient, young dentin, and it's turning into a more transparent and more chromatic dentin with the age. So it's just 3 dentins, but those 3 dentins can give us a base for all the patients. So it is color-coded, as you can see here, very simple to use. And also we have a modifier set that is comprised of an opal shade, an opalescent mass, that it's a paste, and also 3 stains that can be used to do white spots, to fissure stain and things like this. And also color-coded syringes. There are 4 base combinations that we will see for the anteriors. We will start with light dentin plus light enamel, then medium dentin light enamel, medium dentin dark enamel, and dark dentin dark enamel. And these 4 different types, these 4 different combinations is the base that we will use, especially the young and the adult, the central part. You can see these 2 shades. This is normally what we are working with on our daily work. This is our comfort area. If we want to go for a brighter color, we will go for the light. If we want to go for a more chromatic, darker color, we go for the right, to the dark. For posteriors, we will use just either the universal shade or a unique combination of dark dentin and light enamel for all restorations, all patients. Let's see some clinical cases in order to show the capacity of this system. Let's start with the 2 shades on the class 1. We can start by isolation and cleaning the cavity, bonding on the left, and we start with the layering of dark dentin first. You can see the concave dentin, very high chromatic, beautifully chromatic dentin. And on top of that, with light enamel, we just build up very carefully the cusp, following the anatomy. And of course, optionally, we can also use some stains, but you can see clearly that the chroma that has been applied with the dark dentin underneath is coming through the fissure. And that's important for the integration of the restoration. This is after final polishing and immediately post-operative situation. And this is before, after completely rehydration of the tooth. And you can see in all natural tooth that you can see, especially on the central part, if we look at the other tooth here or here, you will see that there is always from the center of the tooth, there is always a lot of chroma coming out. And this is the reason why we want to use a high chromatic shade underneath in posterior restorations. Then let's see how we can simplify really layering with just 2 shades in the class 4. It's a very challenging case. It's a small class 4 in a 11 and a big class 4 in a 21. We start by isolation. We can see here we are going to use, as I said, 2 shades only. We do the prep, we can have this silicone key done upon a wax up, and we can see how much material we are going to add. Again, difficult situation, small restoration and big restoration at the same time. Bonding procedure. We start with the palatal shell, light enamel, very thin, 0.3, maximum 0.5 millimeters. We use the matrix in order to do the enclosure, the complete enclosure, the contact point between both, again with light enamel. And then we will layer just 1 layer of dentin, just a medium dentin here, and we cover it with light enamel again. And we start polishing. Normally I start with red softless disc. I use really very low speed in order to not take out too much material. Then I use the rubber silicone points. And then you can start doing some surface texture with a very coarse, very coarse diamond burr at very low speed, dry. You need to do this with a multiplier, counter angle. You cannot do this with a turbine. And then you can polish again to remove a little bit of this surface texture that you created. This is one of my favorites burrs now. It's a EV Diacom Plus twist. And then I finally end with a GC diapolisher, gradient diapolisher paste from the lab. It's a hard paste with a goat hair brush. We can polish the surface and give a very nice gloss. This material have different compositions for enamel and dentin, so enamel is optimized for achieving a very high gloss, and you can see that we can really get a very nice polishing. And this is the final result after complete rehydration. And we need to consider that this is just 2 shades, so it was a very difficult situation, but it was solved just with 2 shades, only 2 shades. And you can see also the translucency is very nice with the backlight. Also the opalescence, the natural opalescence of the enamel shade is very, very nice. And then we have a veneer case. This is a very tough case because we want to cover the discoloration. We have a natural tooth that is calcified, is a vital tooth, is not endo-treated teeth. And they are still vital, but we need to cover this color. They are very resistant to bleaching, to any kind of bleaching. So what we do is, again, this slide you already know, we make this test. We can see light dentin and medium dentin on the cervical part. And then we have light enamel and the opal modifier in the incisor. We can see this beautiful opalescent effect on the right here. It's really something special. But you can see the natural enamel, the light enamel is matching very closely the enamel color on the lateral. And you can see that the light dentin will be able to cover, to mask this color underneath and give us more or less the same result as we have here in the lateral. That's why this is the best option you have for shade selection. We start by absolute isolation with clamp here in order to go a little bit more cervical bonding technique. We just remove the old restoration and then we start with the new. We again palatal shell, light enamel, and then we just close the contact and build up a layer of light dentin on top in order to mask the discoloration, but we are not 100% masking the discoloration. We are adding our shade, a very whitish shade, on top of a very dark shade in order to have a final result. Then we add the opal just in the incisal area here. We just added in the incisal third the opal modifier, and finally we cover with the light enamel. We start polishing exactly the same technique as we did before, surface texture work with a coarse diamond, and final polishing, final gloss with a goat hair brush. Also, I like a lot the GC Epitex strips in order to polish the contact points and refine these areas. Is very nice because it's very thin and it's not getting rid of the contact point. And you can see the final of this layering. After polishing, we also use a contraster in order to check the color. Then we proceed with the other one, same technique. And this is the final immediately after finishing polishing. You can see how beautiful texture we can have. And this is the final up. We take out the rubber dam. And you can see here on a close-up how very nicely we can match the before after. We can match the surface texture, the gloss that we have on the lateral. And also if we take a polarized picture before after, we can see that just with 3 shades, and considering that this is mainly 1 shade of dentin and 1 shade of enamel, and then just the opal in the incisal, and we just cover a discoloration, which is very difficult normally to have this kind of result just with a very limited amount of shades. And this is the final situation of the smile. And finally, I would like to just show you very briefly that of course we can use a very simplified layering, but we still can use this material in order to really mimic nature, because we have this gradient from a young dentin to an older dentin, which is happening in nature. It starts from the mamelons and it goes up to the cervical. So we can do the same approach with this material, actually layering all 3 dentins here, light dentin, medium dentin, and then a little bit of dark dentin in the tip of the mamelons. We use the opal and then the light enamel, and you can see that we can achieve an extremely natural effect with different kinds of light, normal lights, twin flash here on the left, then polarized, then transmitted light, and then with bouncers. And you can see how beautifully we can work the texture and how natural this transmission of light looks. And yes, it has been created with a so simple system, so simplified system, but the system has been optimized in order to really mimic nature and adapt to what is happening in nature. So I hope that you enjoyed the presentation, and now we will have some time for the questions. Thank you very much for attending the webinar, and let's move now to the questions. Okay, so I have first question. There is a question about trilamination technique. Okay, I guess that you are talking about trilaminar. With GC Genial, we can make it dentin, sclerotic dentin, and enamel available with Essentia. Well, you've seen the result with just 2 shades. Actually, the most important thing, in my opinion, is that the dentin enamel junction layer that we are using in the trilaminar is going to be like a boundary. It's going to be affecting the light because it's a boundary in between dentin and enamel. But this is some effect that you can also partially achieve when you have just 2 different compositions. When you are using a different composition from dentin and enamel, you will also have a boundary between dentin and enamel. When you are using the same material for dentin and enamel, then the chances are that light is going to pass through like it's just one material, because there is no real change in the composition, no real change on the indexes of refraction. So ideally, the best is we start with 2 shades. Of course, we can add a 3rd shade, transparent, in between. We can do it with Essentia, yes, but it's optimized in order just to use 2 shades in order to simplify the technique. Next question is line of demarcation in general. How we can avoid the line of demarcation. I'm not sure if you're referring to a line that that you see on the finishing of the texture, or you are talking about gray area that you can see that you cannot cover the discoloration. You cannot cover, sorry, the fracture line. If it's about the fracture line, the important thing is just to match the proper opacity, to use a proper opacity. Normally when you see a restoration that it looks grayish and it's not really matching the opacity of the rest of the tooth, that normally what it means is that your denting is not opaque enough. And that's very common in composite materials. And that's why in the past we were always layering composites very, very big dentin and very thin enamel, because dentins were too transparent, too translucent. So in order to have, especially on young patients, which are normally the most common situations where you have a class 4, very young patient comes with a broken tooth, and then it's difficult to match this opacity within all system because we didn't have enough opacity. You need a very opaque dentin in order to mask the fracture line. This is the most important part. And then in order to polish, if you see some demarcation line, just a line between between the composite and the tooth, to polish it properly, the important thing is to use a disc, and then, or also rubber, and then polish always the direction, the rotation of the counterpiece needs to always polish from the composite into the tooth, never the opposite, not to mark the difference in the material, not to push particles against the margin, just to keep brushing the surface until you really thin out this transition. I have another question in relation to posterior composite, the flow composite and the first layer, to decrease postoperative sensitivity. Yes, of course, especially when you are using a non-filled material, or it's a normal material that doesn't have bonding afterwards. It's not a primer and bonding, not a 4th generation. It's a good idea always to put a little bit of flowable and light cure again, especially because if you consider 40 microns that are in contact with oxygen, they are not light cured. You apply your adhesive and it's not light curing completely. So it's a good idea to apply the flowable composite and then light cure again, and then we will be sure that our layer of a hybrid layer is completely light cured, and that will of course avoid also some postoperative sensitivity. What is the Opal modifier? The Opal modifier is an the opalescent shade. It's just like a normal paste enamel that has a very natural, very beautiful opalescent effect. Another question. I have used Gradia in the past and use Genial now, but I find GC enamels too translucent, ending up to use almost always junior enamel. I would like to know how translucent two enamels are compared to Genials. Okay, I cannot see the end of the question, but sorry, yeah. I will also like to have your feedback about the interproximal wall in class 3 for restoration. If I use enamel for the interproximal walls, and you get a gray effect. Well, it depends on how do you layer and how thick do you layer these walls. These walls need to be thin, need to be 0.5 millimeters maximum. If you layer 1 millimeter of enamel wall in the proximal, then you will start seeing problems. Same problem can happen when closing diastemas. So you will need some dentin underneath. But it's just a matter of the thickness of this enamel. Regarding the opacities of the enamels, of course, genial opacity of enamels are a little bit higher than what you will see in other systems because they are not really designed to do a very thin layer of enamel on top. When you have a system that is designed to overbuild dentin very big and then make a thin layer of enamel, then you will have enamels that are much more opaque. But as a system that is designed for a more natural approach, you will have a more transparent enamel, because when you are layering enamel on 0.7, even 1 millimeter, as we are doing here, if you have a very opaque enamel, it will completely distort the final result. It will be too wide. So the main opacity, and this is the important thing, is coming from the dentin. It's not coming from the enamel. The enamel is just going to modify a little bit the final result. It desaturates the dentin a little bit, and also increases or decreases the value depending on the opacity of the enamel. But that's the main behavior. We are trying to mimic nature, not going back to more traditional system like layering ceramic in a metal crown. Cavity margin preparation. Do we need beveling? I only use beveling, especially on anteriors, in order to mask a little bit the transitions between the different layers. So we overlap the dentin on a bevel of dentin, and we overlap enamel on a bevel of enamel. And that's why it's just for aesthetic reasons, because normally when we cut enamel, even if it's completely flat, perpendicular on the surface of a palatal surface, let's say on a veneer, we don't really need to make a bevel there. Also in posterior restorations, we don't really need to bevel. The only thing for cavity, for margin preparation, is to polish. It is an interesting thing to polish these margins in order to take out any partially broken rod, partially broken enamel prism that might be there, because with the diamond burr we can break the enamel. It's very brittle. We can break it partially. So with the burr, with the rubber, we can polish it, and we can get rid of these partially broken rods that can really generate then a secondary problem. Thickness of the enamel in the cervical, medial, and incisal area. Normally in these systems we are using between 0.3, normally 0.3 at the cervical. We can move up to 0.5, but it's 0.3, 0.5, then and 0.7 to 1 millimeter. So it's 0.3 cervical, 0.5 to and transition to 0.7 on the medium, and incisal third we can go 0.7 and up to 1 millimeter of enamel. So this is much thicker than what we were using in the old systems. Isolation about adjacent teeth with Teflon. Yes, there is no problem. You can also always isolate the exit color matching. Once you are isolated and once you start working in the patient, there is no way to check again the natural color because it's already dehydrated. So yes, you can always put Teflon tape. You can always, the side tooth is not anymore a good reference. It's only the good reference when you make the shade selection before the treatment. The Essentia Universal is a body shade, just a body shade. It's between enamel and dentin, just to make one big block. and is designed for posteriors. It's just in between. It's to simplify a little bit more. Of course, you can get much more aesthetic result if you do a layering technique, but still it's something that it's a compromise and will give you a good result. For veneering techniques, well, the reduction that you need, how much tooth structure you need to reduce for this veneers, well, it depends. Normally, I always reduce a little bit, but very little. Sometimes even just sandblasting the surface in order to have a raw surface, but not really prepare too much. I prefer to stay on enamel because the bonding will be much better if I stay on enamel than if I go deeper into dentin. So partially is a prep, but also to overbuild a little bit to the buccal surface. With dentin also we can cover very easily, so we have a flexibility. Still with composite we have flexibility in order to increase a little bit the thickness. The only thing is not to leave any step in the cervical. It depends on the age of the patient. I think this is related to a question before, probably the dentin type. Yes, it's related to the age of the patient, what we select, but not always, because some teeth can be more chromatic and older in younger patients. So it's really more on the aging, let's say aging stage of the tooth, but not really necessarily linked to the age of the patient. Some patients, they grind a lot, they drink a lot of acid drinks, and then you will have an increased rate of the aging. So of course it's not always the same. Adhesives for 7 year, I think any adhesive in the market now can work. It's just a matter to use it properly, follow properly the recommendation. There are adhesives that like 5th generation that they are easy to have some problems with postoperative sensitivity. In my personal recommendation will be either to go with 4th generation if we want to go total edge. And on the last times, we have a very nice universal adhesives, 7th generation. Some people call them 8th generation. For me, it's 7th generation self-etching. I think the new adhesives with 10 NDP, they work well, but still I will use them always in selective etching approach, not total etch. What is the closest Vita shade to the masking liner? Well, it's difficult to say. Can be more or less like an A2 or something like that, but I don't like too much to speak about Vita because we are not using Vita here. We are not using Vita shades, but it's a color that will work either for anterior and posterior, can work very well. How to get the proper shape of tooth in the impression if the impression was taken on tooth with all filling? Well, I suggest that before you take the impression, you can add a little bit of composite to the old filling in order to modify the shape, especially the incisal and the palatal, and then take the impression. You can even check the occlusion and then take the impression, and then you can remove the old dentistry together with the new add that you made. How to form the palatal shell from the impression taken before? I mean that the impression was taken on another shape of tooth. That's the same question, I think. Just we can modify it live with a little bit of composite and then take the impression. How do you define the chameleon effect? The chameleon effect of Essentia. Well, chameleon effect normally it's given because we have a lot of different particles, a lot of different indexes of refraction. So it's normally happening in microhybrid materials. Essentia dentins are microhybrids, so they have this kind of chameleon effect. Also, in the posterior, you have the universal shade, which also have this composition, so it will be a more chameleon effect. Of course, enamels are more uniform, and the shade is different composition. It's a more uniform composition. But this is what we want if we want to mimic nature. If you want to do a one shade restoration, chameleon effect is good. If we want to do the dentins, is also good because it mimics natural scattering of light of dentin. But if we want to do pure enamels, then we will need to have a more uniform particle size, a more uniform composition like we have in the enamels from Essentia. Do you use modeling instrument Misura for the thickness? No, I don't use this instrument because this instrument is designed to use a little bit thinner enamel layers. To me, in my hands also, it's not really working too much. I tried, but in my experience, depending on where you place the end of the palatal shell, it will give you a different angulation and can have a different result. So yes, at the end, this is good, but it's designed to be used with the older techniques that you make an overbuild of dentin in the very thin enamel. We are now trying to mimic nature with a smaller dentin, but more opaque dentin, and then on top we use the enamel. So, next question. Adhesives, I already asked this question. Is okay with ethanol wet bonding? Are you using ethanol wet bonding? That's surprising. Yes, of course. It works with any material. It works with any bonding system. No problem at all. You can it's like any other composite in the market. The chemical base is the same, so you can always bond it with the normal adhesives. Of course, ethanol wet bonding, still the same thing. You can also use it with it. Is Essentia stronger than GC Genial? Well, dentins are microhybrid, so you can have the same strength more or less. And the enamels are a little bit stronger because the composition is different, definitely. And this is one of the features why you can work so well this surface texture, because it's much harder material. So you can really work the texture easier. These perichemata that you can see on the surface, you can do them because the material is harder. When the material is very soft, when you start giving the final gloss, it's very easy to start getting rid of all this detail. So you need a hard material for that. Okay, I think this is all for the questions. So I will like to thank you again for attending the webinar, and thank you.
Thank you very much, Dr. Tapia, for sharing your lecture and your insightful information with us. We'd also like to thank DT Study Club for making this online course possible. And thank you, our wonderful audience, for your interest and participation. The CE quiz is now available online on the course page, and completing it will allow you to earn your ADA CERP CE credits. The recording will be posted online within the next 48 hours. You'll receive an email notification with the link to the recording. Further questions for Dr. Tapia may be submitted directly on the website, on the courses page, under the Ask the Expert tab. So please go ahead and submit your questions, and Dr. Tapia will be sure to get back to you as soon as possible. Please be sure to visit the DT Study Club educational platform, www.dtstudyclub.com, and keep an eye out for a growing schedule of online courses. Thank you again to all, take care, and goodbye.